Since the PPPC administration assumed office on August 2, 2020, it has not showcased a comprehensive plan to combat the COVID-19 epidemic. This is the view of former Minister of Health, Dr. Karen Cummings. Noting that the exponential rise in new infections and deaths since the changeover of government is a major cause for concern, Dr. Cummings is adamant that critical flaws exist in the government's COVID-19 response and containment strategies. In a telephone interview with this newscast on Wednesday, Dr. Cummings accused the government of being oblivious of what it takes to expeditiously arrest the prevailing COVID-19 situation, as it is yet to procure the requisite machinery. Moreover, she is resolute in her belief that capacity building at the regional hospitals would not only reduce the burden on the tertiary institutions that deal with COVID-19 patients, but cater for timely treatment of critically ill patients. Dr. Cummings chided the decision by the government to relax the nationwide curfew.
The curfew has been lifted from 6 a.m. to 6 p.m. to 9 a.m. and 9 p.m., I think, to 4 a.m., which means that there are extra 5 hours to be outdoors. And this is a cause for concern. So therefore, the enforcement officers must look for the super spreading events, as we call it.
She pointed out that the practice of selective enforcement of the measures which are being presently executed is in contravention of the gazetted order.
And also avoid selective enforcement, right? They must check the bars, they must check the rum shops, the casinos, These same persons who attend these events go home to their relatives, husband, wives, children, grandmother, and so on, who are vulnerable.
Minister of Health Dr. Frank Anthony has stated that the government, in an effort to protect lives and livelihoods, saw it best to reduce the curfew hours, while the social distancing and wear a mask rules will be enforced. In so doing, the National COVID-19 Task Force on October 1 launched Operation COVID Curb. 500 soldiers have since been deployed across the country to assist police ranks in preventing curfew breaches. Dr. Cummings further opined that troops from the Ghana Defense Force should be more focused on protecting the country's borders.
GDF, they shouldn't be doing that. They should be protecting our borders.
The Shadow Health Minister is suggesting that enforcers of the containment measure should adopt the 3 E's approach.
Engage the populace. 2, we must explain to the citizens of Guyana that they will be held accountable for the spread of COVID-19. And then we must encourage them to adhere to the containment measures.
September has been documented as the deadliest month for COVID-19, with 41 deaths. October started off with 3 deaths on day 1, and today the toll has peaked to 16 in just 7 days. Overall, the death rate has reached a whopping 98. Cases of coronavirus have surpassed 3,200. Temika Rodney reporting for the HGP Nightly News.